Good morning again. Dear Chairman, Presidents, and honorable guests, thank you for inviting Covestro to be the first keynote speakers for today. And we are very glad to join this event for the Hong Kong Plastics Conference 2016. It's also our honor to share with you today polycarbonate solution for medical device innovation of today. I'm Marina Lee. I'm based in Shanghai. Actually, I'm a Hong Kongese, and I'm handling for the industrial marketing for our engineering plastic polycarbonate in the special tool industry, which is quite relevant in Hong Kong regarding consumer products and medical. Okay, so maybe this name is new to the audience to say who is Covestro. But if I say, actually, we are 153 years ago in the bio group, and we are the biomaterial science subgroup. I think that name will be more familiar to you. And this is since last year, September 2015, actually we are independently listed in Germany's stock market, and to become a separate company, we call Covestro. And today we show you with a theme to show you first of all what we have achieved in terms of innovation of plastics in multiple applications using our key products in polyurethane, polycarbonate, or not the last but not least is well the coating. And I will explain a bit with the video to go.
We are curious. We are courageous. We are colorful. We are Covestro, a name that reflects our capacity for innovation, our talent, and the ability to think on grander scales. For there is something that nobody can or wants to do without. High-tech plastics. They are the basis of modern life. Plastics help us to meet the tremendous challenges of our time. Climate change, rapid urbanization, increasing mobility. These are far-reaching developments that demand solutions. We are working on these solutions. We are driving the development of renewable energies. We make vehicles lighter so that they save fuel. That benefits the environment. Our materials shed a different light on the world. We support sustainable construction with components for rigid foam to insulate houses more effectively. We are also constantly coming up with new ideas involving flexible foam. Did you know that you will soon be able to sleep on CO2? Our high-performance plastics are light as a feather, clear as glass, and hard as steel. Ideal for bold visions, perfect for a fast-paced world. Wind and weatherproof, coatings formulated with our raw materials. Adhesives with Covestro materials are incredibly strong, and our ultra-thin films provide maximum security in a world full of sensitive data. Innovation is our DNA. When asked why, we answer, why not? Our employees are working on new ideas all around the world. We ourselves are already using few resources. Relative to a baseline of 2005, we want to reduce our CO2 emissions by half by 2025. That gives us advantages in global competition. We are among the leaders in each of our segments here. Our venture into independence and the successful stock market listing have brought us even greater flexibility and more international attention. We are making good progress for the good of the environment, to move society forward and to create value. True to our vision, to make the world a brighter place. We are Covestro.
Okay, thank you for the screen, and I think it's a good overview to show us where Covestro, and let's move on to the topics about so we already introduced, we have 4 divisions, and we want to actually go into what is the material behind us. So as we mentioned, we have a lot of business, over 153 years of applications in all the applications we show in, mainly in automotive, and also today what are the, for my divisions, we are focusing on medical healthcare and consumer products. Just we have a lot of new plastics-based material in making into resins, foams, and also coatings. We have over 10,000 products, and not to forget, in terms of polycarbonate, actually we are the #1 producers in the world, and we are having 1.3 million tons of products produced all over the world in 3 regions. Actually, polycarbonate is a relatively young plastic, so to say. It is actually invented in only 63 years ago, with one of the scientists actually is coming from Bayer. So this is Dr. Hermann Schnell. And why polycarbonate is such a fantastic plastic for many industries to work with over the 100 years? It is because of its very special properties that fits for all these industries because of its lightweight, break resistance, heat resistance, and also dimensionally stable. So these all are important for plastic to replace metal, so to say, and also replace a lot of structural parts when you're designing products. So when we go to medical industry or medical device, this market is growing very fast in the world, and of course, globally, it is about 375 billion as of today's estimation, and the growth is still around 4% per year. China is even higher, to say it is in double digits, and we will say it is at least above 10 to 12%. How to gain into this market is based on material and technology advancement. But first of all, we first define what is a medical device, because people will say, what is its function? So the medical device, in a very precise term, we need to refer to FDA, but what it means is that it has to be prevent, diagnostics, and also cure. So this is the 3 functions for a medical device to benefit the people or the patient. So if we stop here to say, let me have a bit of quick survey. If the audience is anyone already working in medical healthcare, is anyone already in medical healthcare in Hong Kong or with China? Okay. And anyone has been using some of the material like polyurethane, PC, and also anything related to coatings, medical adhesive? Anyone? Or? Okay, so good. Okay, then if that is not the case, so let's see how it's innovated already into the next decade. I have already mentioned before, polycarbonate is already good already because of its glass-like transparency, lightweight, that is replacing a lot of heavy parts, impact resistance, so that it is good for structural components. What makes medical polycarbonate very important is the 2, maybe a strange word or difficult word, is about sterilizability and biocompatibility. Biocompatibility, and this 2 is the exact requirement for medical polycarbonate to be successfully used in medical device, and our customer and all the OEMs rely on these two properties to make a decision on what they should use. So for us, actually, when we mention polycarbonate, it is meaning we have a variety of already into different types of blends. It is not necessary that only one type of resin can fit all the purpose. And from us, we innovate into different types of compounds into with ABS, PET, PVD for different purpose that I will explain with examples. So in all these application areas, polycarbonate can be used. And all of them have their different requirements to the plastic itself. And you can see from the more detailed examples, this is already related to a variety of organs and also different functions to the device that I will explain into a different slide. For example, this one is already talking about heart-lung disease, and this is used in the heart surgery. So all these three devices are already using for containing the blood into surgery and also into exchanging oxygen when you are having a lung operation, as well as keeping your temperature of the blood under the external circulation. Then you can imagine this is really high-tech product. You need a lot of transparency and also impact resistance to contain liters of blood when during the operation. It is not scaring you. And not to forget, this is also for example, this type of patient for kidney failure. So a lot of people losing kidney function, and with that, you need a different types of device to replace kidney function with an external circulation device, and with that, PC is actually also usable for this type of filtering system in the different forms to remove different types of toxins and unwanted waste. For the upcoming trend, actually you will know that the aging population has grown into an issue not only for Hong Kong, but it's a global concern. And for this, home care device will be a future for people to taking care of themselves and not necessarily in an in-hospital environment. And for this type of device, what is important will become an housing for a PC-ABS blend, and with that, it is a really lightweight, and patients can be like bring along a portable kit and create enough oxygen for them to use. All these detailed small parts, don't forget when your people are sick in hospital, all these are really precise and need to be leak-free components. No, although they are really tiny, but what is saving people is important, avoiding contamination, and also all these parts are made by very precise and high-flow material made of polycarbonate. And also, for example, in the last one, these type of connectors are really made of polycarbonate to use to deliver toxic drugs, like cancer drugs or your radioactive drugs. So with that, you don't want them to leak. You don't want them to contaminate the hospital. So you can imagine for this, although the parts is small, but the importance of material is very high. And people will say metal replacement. One example for metal to be replaced is this, the first one. This is an optical forceps for eye surgery. So the beauty of this thing is the ridges actually made of polycarbonate, and it's like a pen form, and doctors can rotate and still maintain the control of the forceps. So you don't believe that the plastic can be, like a forceps to press and unpress and without break. So this is a very interesting design, and with the property of material you can achieve. And the toughness, we mentioned break resistance and all the importance of how to replace metal also. This type of bone stapler also requires strong material so that when they have the bones to heal, then this is like your stapler of paper, they staple the bones. So you can imagine the toughness, how the doctors can be used to combine the forces of compression to make up the healing faster. Pollution is another issue pollution is another issue in a developed country and also more urbanized city. So a lot of people is also taking care of the chronic disease using portable drug delivery device. What we are showing here is also made of polycarbonate, and this is all the injection pump patients can bring along with himself, and the patient itself control the dose, how to put the drug into the body. So the precision of dosing using the control on the device is an mechanical property that can fit in with the design of the insulin pump. And all the other, for example, it is for inhaling through nose, and also this is all the different types of injectors when people get allergic and suddenly fall down on the street. And this is all electronic device that can have a real-time advice how you should operate and do your own injection immediately. So all these examples are very fantastic, but how people can choose the right material to make this design work, or how to make an R&D phase of a material faster. The important thing is you need the criteria to choose the material properly is also you need to consider what is the risk and what is the contact, so to say, to the body. So I will explain it later regarding device category and also how human compatibility means. And the second thing is about the more complex for a device, the more difficult for you to make it germ-free. So this is talking about when you're doing a device, when you're doing a normal industrial plastic product, it's easy, right? You just pack it and go. But you're talking about pack it and use in a hospital for a sick patient, how you can make sure it is germ-free. And this is important to say when you design a product, a material has to fit with the sterilization, how you clean the device. So this is what we talk about sterilization option. And of course, and what not to forget is about your design, about the mechanical and also the chemical properties, and how you can commercially make it available close to you. So this is a busy chart to show you when you do a medical device, the important thing is that the device risk is categorized by how the material is in contact with the body. So to say these are 3 levels of contact, like the surface, like this on the body, and the other is connecting outside to inside, and also the last part is really inside your body. What I want to emphasize is that I highlight that skin contact is also a kind of medical device to the FDA control. Depends on the time of exposure and also how it is used. So one example, it is already highlighted as an prosthetics, so the artificial limb. For this type of, although you say it is a skin contact, Japan FDA already take it as a medical device, even in the robotics. So the rest of the other example is already shown in the previous slides, that a lot of drug delivery, blood-connected parts are in all different types of higher category 2 and category 3 device that is into the blood contact and also even the bone contact. This is all the requirement for FDA to test the device. We don't need to go through it, but what we want to show is that this is the very complicated list, much higher requirement than a UL. And polycarbonate also can fulfill all of them, you see, in all the different tests to make sure the material is good for device and also it is fitting to use within 1 day or even up to 29 days. And to save costs, to make up the uprising healthcare expenditure, all of them also have a different types of compliance to the biocompatibility, meaning either it's in full version or only skin contact. And I mentioned before, sterilization is important before you pack the stuff and go into hospital, how to clean it to become germ-free. For this, a lot of different sterilization methods is already shown in the table. All of them are evolving from a chemical sterilization to become a steam sterilization with different degrees, 121 and up to 143. And the last is already going into radiation. So you have to think about the plastic. Can it fit to the tolerance to the steam, moisture, and even radiation? So Covestro is doing a lot of technology advancement. What we mentioned before is already shown in the last 10 years. And what here is important is to show that it takes time to do innovation. And what you see that although I mentioned the invention is from 1953, the medical grade we say and make it into available to market is only 10 years or even 20 years into the market. So this is important to think of starting it and make it a consistent development and continuous innovation. And the last 10 years is also an enormous advancement in material to improve chemical resistance, improve thin wall, and also what to mention later is about a wearable device. This is the example to show what if the component is not good for carrying lipid drugs. What we will do is like the part will crack, like on the right side. So the importance for the good plastic should go for an lipid resistant drug so that some lipid-based drugs will not make the plastic crack, and you need to choose the right product to avoid cracking into these connectors. Precision is another thing to do that. This is a needleless injector, and what we are highlighting is that this injector do not need a needle to go on into the skin. And what it comes is actually you are seeing is an inject a very fine stream of drugs actually go through the plastic hole. And the pressure itself is over 30 millipascal. So this is for patients who like insulin into the abdomen and also even to dental use. So the latest advancement for medical device and is upcoming, not seeing the back or the history, is in the future will be the wearable device. So what is a wearable device is actually a convergence between IT technology and medical. So you can see in the future, a lot of chronic disease will be controlled, maintained, and monitored by medical wearable device. So all of these type of device require different types of material to support, like an housing and even the lighting, sensor, adhesive patches, and all of them combined has to be comfortable and biocompatible to the skin. So if in Hong Kong, our industry is going to move ahead into the horizon, and then of course the next wave of innovation will be medical wearable device. And all this is talking about how you make a right housing of right plastic that can be skin friendly, and yet it should be chemical resistant enough to your daily chemical use, lotion, a lot of some cream things put into the skin, because this is something that you cannot put off. You need to monitor your, for example, the blood sugar, heartbeat, and all this. So it's not something like if you're allergic, like an earring, you just throw it away. This has to be in your body and maintain data for doctors. So the importance of a device like that has to be strong enough to support the delicate electronics inside, but yet it has to be biocompatible to the skin to meet the medical device requirement. So all of the last previous slides is all talk about material, but now what we are talking about is a material improving productivity. So what we are talking about is an high temperature polycarbonate, which is very unique from Covestro and only we have. This is talking about an RPEC series of material, which is able to meet the highest temperature of 143 degrees for sterilization. So this is very unique because it will be increasing the speed of cycle time, and also this helps, for example, in hospital and also to the mass production. You can reduce the time for sterilization from 20 minutes to 12 minutes. So this is an example of how to use the high heat polycarbonate to improve productivity. This is talking about a silicone overmolding example, and with using, if you use, I know later on there are other speakers talk about silicone, but for example, with RPEC or this high heat polycarbonate as the substrate to mold on a silicone rubber, it will reduce the total cycle time. For more technical details, of course, we can discuss offline, but then you have to see this is an innovation to help to move off against mass, a lot of handheld device, consumer products, even for gasket and also some closure. This is the advancement that we can make use to reduce cost and improve productivity. So lastly, I want to explain, when you choose a material, you also need to choose a supplier, who to buy from, right? So you choose a supplier to choose from using a medical polycarbonate. What is the difference from using an automotive polycarbonate, right? Maybe the same, maybe different. But what the last slide I want to share with you is that the important is quality. Because this material is talking about life and life saving. So this quality is meaning you need a material that the company can sustain innovation for 50 years, like Covestro or the other company, but then they keep on doing this. You know, you are not using the one from 150 years ago. And we keep on doing it, and you need a lot of help to do R&D design. A life cycle for a medical device normally is 2 to 3 years. Along this time, how you can solve all the problems? I've mentioned choosing material, disinfectant, okay, and all the liability behind. Okay, so quality is something very important. You need to consider not only a material, but what is the support behind that to use the material properly, because all of them are expensive. You know, making a device is expensive, R&D design is expensive. The second important thing you have to think about choosing a supply for medical polycarbonate is still quality. Because what you need is about, I mentioned a lot of regulatory requirement on the material. Can the material have enough proven documentation for you to export to US, for example, to export to Europe? All this documentation requires the resin supplier or the material supplier to provide you, so that you can, as a supporting document, to go into a faster registration into the market. And sterilization option is an issue because metal device is not just one plastic. You may be having some other sealants, you have other parts, it may be metal, but all of them, you have to choose only one sterilization method and make it done. So sterilization is whether it's workable and are they having enough data to prove their suitability of sterilization is important. The last selection criteria is still quality, because what if you have the right material, they have the paper to show this material is safe to use. I can have a lot of documents to show I have all the subsequent processing compatibility. But what if I do not maintain my production process right? And if the supplier do not handle the production of the resin in the right GMP process, like an ISO process, the contamination can start also there. So what is the last part we mentioned is about we have to select a supplier that has a very long track record of supply and still with a good production record to prove the material is suitable for medical use. And last but not least, this is also talk about cost. You need to import, and whether you have a material which is from Thailand or which is from China, you can have a better logistic, and hence for smaller, medical device sometimes it's small lot volume. You don't work to ship only 3 tons from US. So you need to look for some supplier, which we also have a regional supply and plants making medical resin from Asia Pacific. So this is my sharing for today, and thank you very much for your attention.